It is February 9th, 2021. We want to welcome you into Coronavirus Inside the Arizona Numbers. We have new numbers to track today. Yay, we should let off the confetti because we get to have a new chart that is tracking vaccines. We've kind of been doing it the old school way, writing it down, tracking it here in the newsroom, and of course, relying on that information from AZDHS. But now we have a formal tracker to help keep track of those numbers for you. So we'll show you how this thing works and show you the ins and outs of it and walk you through it. We will do that in a matter of moments. We do want to start today just quickly on that summary page where we always do, because we did see some high number of cases, not unexpected today, Garrett.
No, it's a Tuesday. We are expecting to see larger numbers on Tuesdays, and that's what we saw. So today, 4,381 new cases reported today. High, but not out of the sort of range that we expected we could see. And then 231 deaths. Quite high for deaths still. And what does this mean? Essentially, we are in a situation where it seems that January 13th is going to be our peak day for the pandemic. Our 7-day case average on that day was 9,578, with 175 deaths on a 7-day average. Today, we're at 3,169 with a 7-day average of 132. That's a 7-day average of deaths of 132. That case average has fallen and continues to fall every day. We're at about minus 25% where we were last week in that case average, but the death average has remained constant since about January 31st. We've had about 130 deaths. And that really hasn't changed. In fact, I'm looking back through the 7-day average, and it actually goes back to about January 21st, where we had about 130 deaths, and it's been pretty consistent since then. As we've talked about, Katie, we are expecting to see that begin to fall because we're seeing the case levels drop so dramatically, as well as the hospitalizations. But the ventilator ratios are still very high in the ICU. So unfortunately, we're probably going to see some, higher death numbers continuing for at least a small period of time here. But hopefully by the end of next week, we're going to start seeing that part really start to drop. And, we can start looking at the downturn of every metric rather than just all these leading metrics.
Mm-hmm. Yeah. And that would be the most hopeful thing at this point. Obviously, we're counting on vaccinations to help in all of that. Also counting on the variant not taking hold in this state to affect that trajectory of those numbers. So while death still remains high in these cases, you're saying inpatient is down, ICU is down. Pretty much all of those metrics are starting to fall now.
Correct. Pretty much every metric is falling. The only metric that we're waiting to fall at this point is deaths. And because the ICU numbers and the hospitalization numbers have already fallen, that we should expect to see that fall in the death numbers coming very shortly. In fact, I would expect it either to start this week and maybe start to actualize next Tuesday. When we're talking again next Tuesday, we're probably going to be talking about a much lower 7-day average at that time. But here's where we are right now. That's just where we are.
Yeah. Okay, let's get over to that vaccination dashboard. If we have a little time, we can come back to this one and share those numbers. Although I did find that high case count more than double yesterday. A little bit surprising. I obviously thought it would be higher than 2,000, but
it was. 4,000? I figured about 3,500 to 4,000, so it was a little higher than I thought as well, but not significantly so. It was only 4,400. Mm-hmm. Like I said, I kind of had it in that range of 35 to 4,000. So it sort of expectedly, it was around where it should have been, I guess.
So the Department of Health has added in a vaccination dashboard, and we've been walking you guys through some of these numbers statewide and really across the U.S., where we can plug each state in and see how they're doing based on the percent of their population that they've already vaccinated, whether that be that initial dose or their complete set of doses. Here in Arizona, we're getting very close to 1 million doses administered, and now we can track that on this chart.
Yes, correct. I'm sorry, I'm distracted by the comments on the amount of people that are looking at the headline talking about the flu and saying, "Ha ha, we told you so. Flu is gone because COVID took it over, and because you get tested for both." It's so completely unbelievable that people still
believe that
and believe that that's the case. I don't even know what to say anymore.
Yeah, we can, and we'll definitely take some time to talk about those two numbers, how they are a totally separate test.
Yes.
And the big concern that people were going to get both at the same time. You can imagine how detrimental one of these is to your body. If you've ever had the flu, a bad case of the flu, maybe you've been hospitalized for it, or in my case, I was nearly hospitalized for it, an awful situation years ago. And since then, I have never missed getting a flu shot, because I thought if flu could do that to my body, what could it do to my children's body? And I was obviously very concerned as a new mom at that point. And I can't imagine COVID and the flu at the same time. Luckily, they're not seeing that situation take hold as much as they thought they would. And our flu numbers are dramatically down. And listen, here's why. It's because people have worn masks. It's because people are staying distant. It's because the protocol is required. It's because I'm in an empty workplace. I mean, a lot of people are in these same situations. You're at home, Garrett. I mean, these measures are still being taken, and the positive thing in such a negative experience that we're having is that it has pulled down the flu numbers. So everybody that wants to talk about it, we'll talk about it in just a second a little bit more, but yeah, she's saying, trust me, COVID's worse. Husband and I have the hospital bills to prove it. And we saw that last night as well. We highlighted a family who was struggling. They had millions in hospital bills after a family suffering from COVID, and ultimately the patriarch of that family losing his life. So, okay, so let's talk about this vaccination board. Let's talk about the good news and all of it. We'll try to not look at the comments for a few minutes, and then we'll get to some of the questions for those who are serious and are here to learn about where to find this information.
Yes, this is absolutely brand new. It was just released about 2 hours ago. This is a new, if you go to the data, I'm going to start over from the very beginning just so everyone knows where we are. If you go to azdhs.gov, you'll see these buttons here, and there's this button here that says Data Dashboard. Come to here. It gives all the dashboards, the COVID-19 dashboards we have. This is a brand new button right here, Vaccine Administration. We click on this, and it brings us down to a brand new dashboard. As you can see, this gives us all the, let me just go over this basically one by one. So it's giving us the total number of doses that have been administered, 950,000. The total number of people who have received at least one dose, 750,000. The total number of people who are fully vaccinated against COVID-19 with at least one dose administered, 192,684, almost 200,000. And the total number of ordered doses that have been ordered so far, 1.2 million. So those are the big numbers. Here we have some county breakdowns. We have what the dose administration looks like on any given day at any county. And then we also have something brand new that we were all asking for, which is the people who have received at least one dose by race, ethnicity, and age and gender. This is a good development, basically to give us the ability to monitor and track what the vaccine administration looks like, and just make sure that people who are needing the vaccination the most are getting it in the proportion of the population that they should be.
Mm-hmm. So when we look at these numbers, we're so grateful to have the breakdown. Obviously, it's about equitable distribution of the vaccine and making sure that everybody has the opportunity to be vaccinated when their time slot is ready. But when we're looking at this, Garrett, and I would need your expertise on this, would it be important here to look at that split by race and ethnicity and compare it to the numbers that we see in the overall population here in Arizona?
So what I would say about that right now is I would be cautious about making too many comparisons to the race and ethnicity data at this time, and trying to make a like-for-like equitable sort of comparison. And there's a couple of reasons why. First of all, as you can see, let's just point out the obvious here. If you look at the people who've at least received one dose by race and ethnicity, it's overwhelmingly white. 47.9% have 47.9% of the vaccine administration has gone to white. Hispanic or Latino, the second largest ethnic group, is only 8.2%, about 61,000 vaccines. Herein lies the problem that we need to be concerned with. 37% of the data that has been put into the system has yet to be assigned or classified a ethnic group, a race.
Mhm.
So without that, that's a massive hole. That's 277,000 vaccines that we don't know where they have gone. We don't know if this is more, if it's equally distributed amongst all ethnic groups. We don't know if it's just, mostly Hispanics. We simply don't know that. And without knowing that, it's really hard to put them across from each other, simply because you could be making a lot of incorrect assumptions by doing that. And you don't really want to do that. So that's something that's going to have to, over time, be corrected as more data comes into the system. This number should theoretically shrink. And let me tell you why this is important. I'm going to go to Yuma County right now, just to show you Yuma County. Okay, Yuma County, we all know, is a majority Hispanic county in Arizona. There's two of them. Yuma County and Santa Cruz County are both majority Hispanic. And you can see other race unknown is 50% of the vaccines that have been distributed or administered in Yuma County are other race unknown, followed by 27% Hispanic and 22% white. So that gives me pause, simply because that other race / unknown is the highest demographic in a predominantly Hispanic community, county. That makes me think, well, we should probably wait until they get a little bit more of this data figured out to understand what these numbers look like. And then also, one thing we can look at, we'll look at this too. When we look at the state PODs, so if you click this button, now we're only looking at state sites. We're looking at State Farm Stadium and Phoenix Municipal. This is interesting because when I just said it still applies, but a little less so, because that white demographic for these is 62%. That is a massive proportion. And the other race unknown is 30%. Hispanic or Latino is only 3.8%. So there's a severe basically
deficit there.
Gap between white and Hispanic at the state PODs. The other thing to think about when we're looking at this data is we don't know where in the phase what it should look like based on the phase. So right now, obviously, not everybody can just go and get a vaccine. This is obvious. We talk about this every single day. You have to be either in phase 1A or phase 1B, or priority phase 1B, essentially, which is just, it's basically healthcare workers, education and childcare workers, and 65 and up. Well, that's a completely different demographic set than, say, the census demographic or the COVID-19 demographics that we're comparing to the census data. It's just a completely different demographic. So without knowing that, we're also making some incorrect comparisons, because as of right now, the vaccine is not available to everyone. So again, those are the two reasons why I would be cautious about looking at this data. But even in saying that, we look at the state PODs and we say, wow. And again, I'm not saying that there's anything wrong with this. We just don't know. Mm-hmm. What is it about the state PODs that the white demographic has such a higher administration rate than any of the other demographics? I just don't know the answer to that yet. But these are things that we just have to ask questions. Why is the imbalance? Is it because the state PODs were open longer? Is it? I just don't know. You know, so these are the things we have to ask.
Yeah, and full disclosure, you've been in communication with some of the folks over there who are putting these things together to get an even better understanding, a deeper understanding of what metrics they're using. And you're absolutely right that the population that they're pulling from, I mean, we've done some digging to find what those numbers look like, what number of Arizonans are 65 and older, what number are 75 and older, how many people do we have in the healthcare profession. And when we look at this chart, obviously that's going to skew the age section dramatically, because the age section, as you can see, most are 65 plus, and that would speak exactly to that category of that group being allowed in at this point. So it's a good example of how that changes things. Yeah,
you can see the ratio. The highest demographic, essentially, component
allowed to go
right now, and have had the vaccine administered are females that are 65 years and older. About 195,000, 196,000 of the vaccines that have been, the doses that have been administered have gone to females that are 65 and older.
Yeah. So it's not unlike what we saw, what the items and the numbers I presented yesterday that were a nationwide look. And granted, that was just the first month that we
Correct.
were able to pull that data from, but saying that it's, women, it's white, it's over 50, it's, it was pretty specific to those groups and how that breakdown is. So that's not unlike what we're seeing reflected here in Arizona. So if you want to access this chart, it's on the AZDHS site. You can click through each specific county. And Garrett, you were also saying when you click on that county, that's going to say what group number your area is in?
No, that's something that I have to talk to them about because
because it's not listed there.
Yeah, if they're going to basically get rid of the PDF, they need to give us something for the phasing, because right now that's one of the weaknesses of this dashboard right now. It's an easy fix for them, but it doesn't have any phasing criteria, so I have no idea what phase each county is in this data. That's
based on that.
I would love to see them add at some point is the phasing data, but right now we don't have it.
Yeah, we've had good luck though over this past year when we've presented things that we'd say like this could be very helpful, that they have indeed added that in, and that's been a helpful sign in all of this. Just to refresh from yesterday, the counties that are in 1B plus 65, so they're going to take 65 and up in the 1B category. That's Apache, La Paz, and Navajo. Now Santa Cruz County is in 1B, but they are not including the 65 plus at this point. Every other county is in priority 1B. So that is not including the 65 plus. You got to be 75 plus if you're going to one of the county sites. And then if you're going to one of those state-run sites that we've been talking so much about, that is State Farm Stadium and Phoenix Municipal Stadium, those are accepting patients that are over 65 years of age. So hopefully that helps kind of break that down and where those numbers look. I did see on the chart, they're also giving us or letting us know where these doses are going specifically. I don't think it's on this this page. It could still be linked on there, but they have a PDF that they've included and let you know how many doses are going to each county. They're also letting you know how many doses are going to the state pods and that CDC pharmacy partnership as well, which has gotten 64,000 doses of the Moderna vaccine. So for those of you, people were asking yesterday, how do I know if I'm getting Pfizer or Moderna? And it just depends on the site that you are going to. So many of them have Moderna. I would say most of them have Moderna, and then the state pods have Pfizer. So hopefully that helps answer some of those questions that many of you were asking yesterday about how that exactly splits. Okay, if we're done on this page and we see that chart there, the increasing numbers, which is obviously also pretty helpful in all of that, and we'll continue to track it and see if there's any anomalies that we need to alert folks to. In the meantime,
this is one chart we don't ever really want to see go down.
Dip.
It should continue to increase over time constantly. And we talk about tests and cases and, the tests are going down. The vaccine should never go down. It should take, eventually they're going to go down, but we only have about 9% of Arizona that is vaccinated right now. So it should theoretically continue for quite some time before our vaccination rates begin to slow.
Yeah. Okay, so there was a big conversation yesterday about the +1. So what sort of happened here was the president and vice president did a virtual tour of State Farm Stadium. Dr. Carrichrist was sort of walking them through this virtual tour. It's amazing that we're even able to do that. But they were able to see everything as it was going on and the process and how things work. And Dr. Christ happened to mention, and also if people come here and if we have enough vaccines, we'll sometimes honor a +1. Now, I've heard from a lot of people today who went with folks who had appointments and said, I was so hopeful to get my +1 and did not. So please remember, if you're headed over there, that is not a guarantee. It just matters if they have some extra doses that they're ready to give out in that amount of time. And it's a game time decision, if you will, by a clinician who's out there deciding on that case. So I spoke with one person who's over 65 who went with someone that was 82. They were hoping that they could get theirs. They were not able to get theirs today. So please don't go thinking that you're going to be able to necessarily be the +1, even though that was a big discussion yesterday. We want to set expectations appropriately. Okay. You ready to talk about the flu, Garrett?
I'm looking at the comments and it's going to be so much fun.
So there are different tests for the flu and for COVID. You can go take a test for COVID and have it be negative and go take a test and know that it's the flu. So the only time you're confusing those things is when you're doing a self-diagnosis at home. When you're sick, you're feeling symptoms and you're like, Might be COVID, might be the flu. Doctors themselves aren't confusing that because there is an actual separate test for those two things. The concern in all of this was that folks would come down with both at the same time. And then that would be so concerning because your body would be so overwhelmed to deal with this. They, in fact, named it to help make sure everybody knew that this was a concern, naming it a twindemic. We spoke with doctors on this. They're not seeing that scare here in Arizona. What the message that they do want to send is that it is not too late to get your flu shot. They had a huge number of people, higher than normal, getting their flu shot. And Garrett, it feels like so long ago. I got mine in October.
Mm-hmm.
It feels like a lifetime ago to think of October and to think that people still haven't gotten it and that they'd still be okay to get it because currently we are in the height, what should be the height of flu season.
Yes, correct.
The numbers are not reflecting that. We are down 95%.
And exactly. Yeah. So first of all, obviously, PCR tests are not flu tests. You cannot be tested positive for the flu with a PCR test. It is impossible. It's not even unlikely. It is impossible. You can't do it. So let's just, I see a bunch of comments and it's just blowing my mind. It's literally a molecular test for proteins that are found in COVID-19. So you can talk about cycle thresholds and all that stuff you want. And I know there's some people that think that there's the Illuminati that are telling people to actually turn down the cycle thresholds now that Joe Biden is president. Completely absurd that people would think that, but I can't make you stop thinking that at this point. But it is absurd. There's so many fractured laboratories that have PCRs. They're not getting some sort of email from someone saying, hey, by the way, turn the cycle thresholds down. That's just not going to happen. So sorry, I just went on a rant there. But
that's okay.
Yeah, well,
no, it's
please continue.
It's worth explaining because I think people think that they're just hanging out at home. Now you could confuse the two based on the symptoms if you hung out at home. If you get a lab certified test, you are going to know what you have. So 95% is how much things are down, and they're crediting that, and 95% down in flu, and they're crediting that with the mitigation I can't even talk now. Mitigation efforts that we've all taken to stop the spread of COVID work in the same way to stop the spread of anything. Kevin's writing best rant ever. It's just fascinating that a year later we're still having to dispel some of these myths. So it feels like, every day we're talking about it, but we love you too, Margaret. Thanks for joining us. But it's worth explaining. There are two absolutely separate.
Here's something interesting. So I've seen this comment before. I'm not going to pick on you per se, Carol Myers, but you're saying there's not flu because of COVID. I think I know what you're saying, but that is absolutely correct. There is no flu because
we're taking these mitigation efforts.
These mitigation efforts to stop COVID. We're masking. I'm sitting at home. I've been here working basically almost for a year now.
A year.
It's going to be a year in about a month. And we're not going out as much. We're not working in the office. We're not doing these things. So yes, COVID or the flu was cannibalized by COVID, but not in the way that some people think. It is not. They're just assigning COVID cases.
Yeah.
There's no financial incentive for anybody. When I had COVID, there is no financial incentive for anybody to assign that as COVID. I am not a Medicare patient. I didn't go to the hospital. There's no reason. Zero reason to assign me as a flu patient or a COVID patient if I had the flu. There's just nothing. It doesn't matter.
So specifically these numbers, Carla Navarrete pulled the numbers for you. We've done that periodically throughout our conversations here over the past year, so you could actually see what these numbers look like. Now, the flu season runs from about September to September. That's the way that they track it. Full reports come out a matter of years later because there's investigations that need to be done. And then you guys can go read those full flu reports on the AZDHS site. You can see what year. There was a year about 5 years ago that we had a really high flu season.
2017, 18.
Yeah.
Yes.
And you can see those high numbers. If that happens again, we now know the mitigation efforts that we've practiced for COVID that we can apply to that as well. I'm thinking in the future, if I have some big event and I don't want to be sick before it, or, I just don't want to get the flu for a multitude of reasons, I'm going to pop a mask back on. I'm going to revert to 2021.
Yeah, exactly. I think at some point, there has been some introduction to the culture of mask wearing in the United States and in the West. And if that does include, I think you're right. The flu will start to go down. No, I don't presume that mask wearing is going to be like a thing we do every single day in 3 or 4 years. But as you said, on certain occasions, in certain, if you feel, oh, it's flu season or whatever, you might pop a mask on and people won't look at you like you're weird now. Let's admit it. 2 years ago, if we saw people walking around with masks all the time, we'd be like, okay, what's up?
Yeah, what's going on?
But that's not going to be the case any longer. So, I do believe that the flu season will probably be much lower for the foreseeable future, for a long time, actually.
Yeah, so we just saw the comment that was popped up there about being one of the first people at her pharmacy to experience flu this year. And that is, that could be definitely the case, because here are the numbers. So for last season, our full total, so that's the 2019 to 2020 season. So really the flu season coming before the pandemic hit, 19,000 Arizonans were in lab confirmed flu cases. And then this last year, this flu season, only 815. So 815 cases compared to 19,000 cases. You see what a big difference this has been in the last year. Loving all the comments, you guys.
No, I know. Don't put the comment up because there was a bad word, but someone's like, well, that's because COVID is the flu. I had COVID, dude. It was not the flu.
It's not.
I had symptoms that I would never, I couldn't smell for like 4 days. That is not a flu symptom.
Yeah.
I didn't have any flu symptoms. Okay. I got very lucky with COVID. I got very few symptoms of any sort of respiratory issues, but I couldn't smell. I could barely taste. Those are both not flu symptoms. I had a laboratory positive test, so I know I was COVID positive. I did not have the flu. So no, it's not the same.
Yeah. So Mike's asking, are doctors testing for flu or just COVID? They're testing for both. If you're negative for one, they're going to test for the other. They're testing for everything.
If you go in for a COVID test, they're giving you a COVID test. They're not giving you a COVID and a flu test. I went in for a PCR nasal swab test for COVID. So they wouldn't have told me, oh, you got the flu.
And you did the drive-through one. You didn't go to your doctor's office.
Yeah, no, I went to an urgent care. So I wasn't like, I have symptoms X, Y, Z. I mean, it was obvious I had COVID. So they didn't have to do, a bunch of tests. They literally just said, yeah, you have COVID. Now we're just confirming it. And that's exactly what happened.
Yep. Steve, thank you for the comment there. He writes, I'm glad you're feeling better, Garrett. We are too. That's for sure. Okay. So I think we probably spent enough time on that. I do want to say that you can find when you are truly interested in understanding the flu numbers here in Arizona or wherever you're watching from, you can find that information from your Department of Health. Now, the chart for the past 2 years is going to look different than anything that's farther than 2 years out, because the full report is included when it's more than 2 years. When it's a most recent flu season, you'll see more like a counter on there that's going to give you the numbers. And yes, it gives you the death numbers as well. I saw somebody asking about that. We report pediatric death numbers always, all year. And thankfully there are not many, but any one is obviously a great loss and something that we have reported here year after year. But the general flu numbers, unless there's a trend, that's when we actually report on that. Someone take Garrett's blood pressure. His forehead is getting red. Kevin, thank you.
It's a fun group of people in the comments today.
Yeah, well, with a headline like that, sometimes it brings everybody out. So anyway, so when you want to dig into the flu numbers, or you're actually curious about learning about those numbers and how they look in the state of Arizona, be sure to go to the AZDHS site and you can see it all right there. Okay, so let's look at a few other numbers. We spent enough time on that. We're already almost 30 minutes in. So the active COVID cases here in Arizona, wow, your numbers have really fallen a lot. So the methodology in this, I just want to remind everybody, because we have a lot of new names and faces on there today. So we take the 787 total COVID confirmed, lab confirmed cases here in Arizona. Sadly, we have to subtract out the 14,286 Arizonans that we have now lost to COVID. And then we look at the infection date. Is that the testing date, sample date?
We look at the date. Yeah, we look at the data collection for the positive test, and then we go back 14 days for one of the estimates, and then 27 days for the vast majority of people that are not COVID long haulers, and that's the vast majority will not be COVID long haulers. That is basically going to be the end of their infection, no matter what. So unless you went to the hospital, you are not going to be infectious or have really any amount of COVID after 27 days. You may have some, there's some people that have the smell thing that goes on for a long time, but they're no longer infected with COVID. They just now have a neurological issue with their smell. And so anyway, that's just the epidemiological reasons as to why we do that. So the numbers, the low active estimate, under 14 days confirmed 51,746 cases, under 27 days 135,868. So basically, out of the 750,000 tests, or
787,000 total cases.
787,000 cases, about anywhere from 57 to 130,000 are active infectious.
Yeah. This is one of my more preferred numbers right now. I know at different points in the pandemic, there were numbers that I myself and many other people watched closely. Like I remember in June, the percent positive was one that I really watched. I'll say this active case range is probably one of the most interesting to me right now, or the most telling right now. Hopefully these people are quarantining, this 50,000 to 135,000. You hope that they're quarantining, but it just kind of, there's people that might not know that they necessarily have it right now. So I definitely, I just kind of look at that number closer when I'm making decisions about, running to the store or running an errand in person. That's kind of the number I watch right now. All right.
Yes, correct. That is, and then what I was going to say is that eventually, I think moving forward, I'm going to start breaking that number down through county if I can.
Oh, interesting.
Because we're getting to the point now where we're starting to see counties like Greenlee are starting to show 0 days again. For a long time, Greenlee was the first and only county in Arizona to at some point be zero COVID free for, I think it was like 3 days. The county was COVID free in September or October. And so I want to start to bring back those county numbers. So at some point we can see what counties look like as far as, are we going to get to the point where a county like Greenlee that has always had a fairly small infection rate, are they going to be COVID free at some point?
Yeah. And that's kind of like what we saw at points in the summer too, when different counties were having a very different storyline to what was happening, whether that be in hospitalizations and stressed out medical systems there, or just in the sheer numbers. When there was no one seemingly with it in Greenlee, it's a very different situation than in Yuma County or Pima or some of the others that we saw with those numbers. Okay, so one other leading indicator that's always so hopeful and really telling, I say hopeful now because it's down, but our ER visits, those seem to be really plummeting right now.
Yeah, they are.
Can we better understand how that percentage breaks down and how we're seeing fewer people visit the ER? And I say leading indicator for those of you who aren't with us every day here, because it can kind of let us know what might be happening down the road, and as we try to make some progress in this, watching that can help us kind of get an indicator of things, especially when we see this variant. And we'll talk a little bit more about that in a few minutes.
So let's look at the ER numbers right now. You can see that there's been a break in the pattern of reporting for ER numbers. You can see there's been this up-down pattern until about the 30th or so. And now it's just on basically a downswing. This has been the only area in which we've seen sort of a leveling off. We've lost about 40% of our ER visits for COVID-19 in just the last 10 days or so. In the last 7 days, I think it's down 20% in just 7 days.
Wow.
You can see from here to there. It's in a free fall right now. So we are definitely seeing, and again, these numbers, especially the ER visits, these are COVID agnostic. These are testing agnostic. So I know people think, oh, you guys are testing for this or testing for the flu, or you're assigning everybody COVID. These are people that come in and say, I can't smell anything. They didn't get tested. They just come in and say, I can't smell anything. And so they're like, ER's like, oh, I guess, we have to test you for COVID. Or somebody who comes in with very specific symptoms that are on the COVID list that may be much more serious than just, I can't smell anything. And they have to put them in a hospital bed. Well, those people are also, the number of those people going to the ER is dropping as well. So all of this is a good indicator that we see this with the cases numbers and the hospitalization numbers. Everything else is falling, but this is a leading indicator, and it is dropping like a rock right now.
Okay, so obviously that's good news. We'll keep tracking that. Meantime, we sort of alluded to the variants there, but we want to show everybody where you can find those numbers. The CDC now publicly tracking on their website that you can do a pull down bar for the different variants if you're curious about what's around you. And this doesn't just apply. I know we focus to Arizona numbers here in this conversation, but for those of you watching from other places and other states, you can check out your own state there and see how things look, and check out your neighboring states as well. Because it's CDC, because it's government run, we don't have the luxury of seeing obviously Canada and Mexico and their numbers, and that's a concern for those of us here in Arizona as we track these numbers all around us. But it is a worthy tool when we see Colorado and California and New Mexico. And so here in Arizona, and Joanne, I'm seeing your question there, so we'll be sure to show you how it looks here in Arizona.
Yeah, let me share this right now. Now, there has been some competing articles in some science journals and some other places that are saying that the variant, especially the UK variant, is much more prevalent.
Yeah.
What we have here. And again, because these things have to be sequenced, and I do not know if every test is sequenced for one of these variants. I simply don't know the answer. They may just take a sample of the positive tests that come in and sequence them. I just don't know the answer to that. So here we go. Right now we've got 690 that are confirmed variant UK cases. You can see 150 of them are in California, 4 of them are in Arizona. And then in New Mexico 2, Utah 3, and Nevada 5. We have the P1 variant only existing still. This is the Brazilian one. This is kind of the scary one because this is the one that both transmits more and also is vaccine resistant. And this one's got 2 in Minnesota and 1 in Oklahoma. And then variant B1351, which is the South African variant. This one is, you can see, very much on the East Coast here, South Carolina, Virginia, Maryland, and probably DC. I can't really see it in there, but probably.
So this is the place that you can find that. They keep adding to it. There's 3 that are tracked there right now, and just use that pull down bar to see your state.
To make sure everyone understands, there are probably thousands upon thousands of variants.
At least, yeah.
There's variants all over the place. People look at variant, they go, "Oh my gosh, this is like a whole new mutation." This thing mutates all the time. It's just that every once in a while there's a mutation that sort of tweaks it for the better, for the virus, if you will.
Right.
Be very
not good for us. Better for it.
For the virus.
Yeah.
And so when one of those variants is sequenced and they start seeing sort of a cluster of cases, that's when they say, okay, we really need to watch this particular variant. And so they pour more resources into sequencing and finding that variant. But there's thousands and thousands of variants. I bet you at this point there's an Arizona variant, but it was so nondescript from the quote unquote standard COVID-19 that it's not going to get a name or a news story. I mean, I'm just speculating, but I'm saying there's just so many variants of this thing at this point.
Yep, exactly. They were saying how many were just in Florida alone, and people thought at the Super Bowl and went, oh boy, people are traveling back from there.
The vast majority, I see Joan asking, so how protected after vaccinations from variants? So as we just talked about those thousands of variants, the vast majority, the vaccination is absolutely perfectly, it will vaccinate against every one of them. The way that they designed the vaccine, which is an mRNA vaccine, is it's basically teaching your body to attack a protein on the spike of COVID-19. And since the spike is such an important part of the virus, it doesn't mutate that all that often. So that's why the vaccine is continuing to be effective against COVID-19, any variants. But as we talked about with the Brazilian and the South African vaccine variant, they have been some mutations to the spike protein that have caused it to sort of give the virus a bit of an invisibility cloak to the vaccine. And that's the cause for concern, is that it has mutated those particular parts. And the UK variant, the concern is not the vaccination. The vaccination as of this moment is as effective against the UK variant, my understanding, as it is against any variant of COVID-19, but it's just that it's so much more transmissible. Something 50, 60% more transmissible.
Yeah. And therein lies the concern, because if you have more people showing up with cases, like we have always showed you here in Arizona, for example, 7% of those cases end up in the hospital. So just by the sheer volume of cases increasing, take 7% of that. That's what ends up in our hospitals in Arizona.
problem. Yeah.
Yeah, 1% ends up in our ICU. So you see how that is sort of a domino effect to the response. Okay, you ready for brushing your teeth? Let's talk about that very briefly. Some interesting information coming out. Another reason to keep brushing and flossing during this pandemic is because researchers found those with gum disease who also then contracted COVID-19 were at least 3 times more likely to have some severe complications from the virus. There's a team of international researchers, and they're publishing their findings in the Journal of Clinical, I'm going to missay this word, Periodontology. I can never say it. Periodontology. So anyway, so in this journal, you can find a little bit more if you want to read more about it, but that's where they publish their findings. And basically what they're saying is those with gum disease who then also got COVID-19 3 times more. So that's the concern, is that you're going to have 3 times more severe complications from this virus. The study did look at more than 500 people. I'm sure they'll look at this a little bit more, but 3.5 times more likely to be in the ICU, 5.4 times more likely to need a ventilator, almost 9 times more likely to die of the virus. So good dental care and flossing and brushing, always important. But if you'd like to read more a little bit about it, you can do that there. Okay, let's see. We just have a matter of minutes left for a few more items. Again, I do want to stress it is not too late for the flu shot. That was one of the big things that we talked about. If you want to see Carla Navarrete's reporting on the flu information that we talked about there, you can find that on our website at abc15.com/coronavirus. And then I know that people are still struggling with getting signed up for a vaccination. I want to make sure that you have that information on where you can do that. And there's a phone number you can call, 1-844-542-8201. So once again, this is Arizona only. Joan saying, okay, getting teeth cleaned routinely. Exactly. That number once again is 1-844-542-8201, or you can just make it super simple and call 211 if you're here in Arizona to get more information. And then the sign up place specifically is podvaccine.azdhs.gov. Once again, there on the bottom of your screen, podvaccine.azdhs.gov. I know it's been a struggle. February 11th is when these pharmacies are supposed to have more of their supply to be able to get it out. And as Garrett and I saw yesterday, and this is something for those of you who are in that 65 to 75 age group, worth checking. I went back later, Garrett. I actually had a family member in that age group call over to the pharmacy and see what they had to say. They said that they didn't have doses, but it's interesting, when I went through a lot of the Fry's locations, we're saying 65 and older. So it is one of the things that you'll want to check, especially coming up after Thursday, because February 11th is sort of like the date that's been set for a pharmacy, a bigger pharmacy rollout. So it's worth checking on that date. But look for those that'll possibly take you. It might be a soft rollout and they're just not sort of advertising it, so they don't have a mad rush over there. But Garrett and I were both a little surprised when we pulled that number up to see that they had some of those pharmacies that did say 65. Not all of them. I went back and went through the chart. A lot still say 75 and older, but it's worth a shot if you're in that 65 to 75 age group and you haven't been able to get over there yet. All right, Garrett, what are you going to be watching these next couple of days? I know that hopefully we can be back with folks tomorrow, but then we're done for the rest of the week. And tomorrow we should have perhaps more numbers from the county on our schools.
Yeah, I think we get school data tomorrow, so we'll look at that. We're looking at, we're getting to the point where we're getting closer and closer to start seeing some of the school districts be into moderate transmission right now. And this, of course, every time I say this kind of stuff, it's always assuming trajectories don't change. You know what? I'm looking at that. We're going to continue monitoring the ICUs. We're waiting for the ventilator to ICU ratio to start coming down. That's going to start, I want to see these metrics that will start bringing down this death number. Pretty much everything else is sort of primed to bring down that death number, except for the ventilator to ICU ratio. And so we're waiting for that one to sort of be the next shoe to drop.
Yeah, this is definitely the saddest part of this pandemic, to see 231 Arizonans losing their lives, just reported in within the last day. 2.3 million around the globe, 467,000 here in the United States. So we pause, as we do each and every day, to remember those of you who are dealing with this, who have disproportionately experienced this pandemic because you've lost a loved one, and also pausing to remember those who are gone way too soon. I mentioned this months ago, but they said on average, when people were kind of saying, "Oh, they were gonna die anyway," type conversation, that no, in fact, that is not the case. Most people on average had 12 good years left in them, and we always think of what can be experienced and everything that you could do in 12 years of your life and how important that is. And so it really was stealing life from a lot of people. And that's just on average. Obviously, there are much younger people who had a lot more years to lose. So, okay, so let's end on a hopeful note. Those vaccinations should cross the 1 million mark very, very soon here in Arizona. That is just total doses, 750 initial doses, 192 full doses. So that is something to celebrate. We'll keep walking you through those numbers and tracking it. You can find that on the AZDHS site. Oh, Barbara, let's leave with this last comment. 1 extra day is amazing. That's for sure. Live life full. That is for sure. Okay, so where you can find us, thank you, Barbara, for that. Where you can find us on Twitter, Garrett is at Garrett_Archer. My address on Twitter is at Katie Rammel. Past 10% in the nationwide vaccination numbers yesterday. That was something to celebrate. Posted that over on my Twitter account. And you can keep the conversation going on my Facebook page, facebook.com/news from Katie. I've just posted there what state has had the greatest percentage of vaccinations. So if you didn't hear our conversation about that yesterday, it's not one you expect. We'll talk more about it soon. In the meantime, if you've missed any of our coronavirus reporting, you can find it at abc15.com/coronavirus. Our newscasts have already started. I hear them happening out there right now. Our 4 p.m., 5, 6. We also have one at 9 on CW, and our 10 p.m. newscast. I should mention, I don't even know if this impeachment stuff's still going on. I had to look back there at the screen. So if you're missing any of our newscasts and our coronavirus reporting because of the impeachment trial that's going on, remember that you can still find that on your favorite streaming device. You can find that on our app, or also on Roku by searching ABC 15 or whatever one you have, Apple TV, Android TV, any of those. So you can find us there just in case we're not on the actual TV screens this afternoon and tonight. All right, be safe out there, everybody. Keep your mask on.